right. Well, hopefully you've followed that. And that's the first time Alan's read this poem. So I want to thank him very much. But I'm going to tell you a story because when my own father was very, very ill, and he was an animal person, he guided me to become a veterinary surgeon. I grew up with many, many pets in my life, from tortoises to rabbits to ferrets to dogs, and then some other animals too. But when my father was very ill, he said to me, I was in the hospital visiting him, and he said, Pauline, he says, Mila. And Mila was his golden retriever. And Mila had actually passed away 2 or 3 years earlier. And my dad said to me, Pauline, he said, I see Mila. She's waiting at the door for me. Now, I had no idea where Mila was, but my dad knew Mila was waiting at the door for him. So all I can say is, I don't know if there's a rainbow bridge from animals, but I certainly hope I meet some of my beloved pets again, if there is a rainbow bridge out there. Okay, any questions so far, anybody? Okay, I'll take no noise as no questions. So I've described the different emotions people may have. This is similar, but this is actually the journey through grief. And then we're going to go on to talk about the actual process of euthanasia, expectedly and unexpectedly. So we currently say there's 11 stages. Some people say there's more, some people say less. But the journey through grief usually comes starting with shock and denial. Then emotions get released. So once you know that your dog is dead, we cry, or we talk, or we do something. There's something usually happens, and the body has reactions. You feel sad, you perhaps are shaking, perhaps you want to turn to your best friend or your partner and perhaps just share this little moment. Then some people feel guilt. Could I have done something quicker? Was it the right time to let my pet pass away? Did I miss the fact that he was sick and he could have been treated quicker? I know when I lost my last cat, a big fat cat, I think I showed you his picture in my first lecture, my big fat Fergus. He died very quickly with me. He was only 13 years old. He died within a few hours. Once he had passed away, I felt so guilty. I was crying. I couldn't believe he had died, and I felt guilty. I wondered if perhaps I had missed the fact that he was ill for a few days. I hadn't actually, because we did do an autopsy, and he had a very quick onset pneumonia condition. So I don't think anybody could have saved him. And it did help me feel a little better and less guilty. After guilt, we feel anger. And even with Fergus, I was angry that he had died. I was angry he didn't tell me he was sick quicker. So we get anger. Then after anger, we feel depression. We feel sad. Why have I lost my pet? And maybe panic a little bit. What am I going to do? I usually take my dog a walk at 10 o'clock at night. What am I going to do? I don't have a dog to walk. Do I not go for a walk? You feel a panic. Just like I described about the lady putting the food down every night for her dog Bobo. She was depressed, and perhaps she was panicking. I don't know, but she knew that she had to put this food down. After you work through the depression and perhaps the panic that your animal's not there anymore, you begin to accept the fact that your animal isn't there. And then you begin to idolize the animal and realize there's a life ahead without your dog. New patterns begin, and you learn to live with the loss of your pet. Now, this journey through grief is different for different people. Sometimes it can be a very short space of time, or sometimes it can be months, literally months. Sometimes it can be years. Sometimes people never want another pet again in their lives. Okay, so we're going to talk first of all about expected deaths. Now, the veterinary clinic is the only place that most people will make a decision about death. I just move you over. We make life or death decisions. And making a decision about the life and death of your pet is very, very confronting. I often say you don't get this very often in your life. In human hospitals, do you get asked if you want somebody to live or die? No. The only other places, or few places, that people may be asked to make this decision, can anybody think of one? Where would a human being make the decision of life and death of another human being?
When that person's life comes to an end?
Yes, but unless you're in a country that allows euthanasia, and some countries like the Netherlands allow euthanasia. I'm not sure which other countries, but certainly the Netherlands, I think maybe France. People from all over the world go to the Netherlands because it's legal to have human euthanasia. So most countries it's not. But to take the life of another human being, who possibly has the right by law to do that? And it's places where they perform executions. So a judge in a court of law might order another human being to be killed. In some situations, like in war zones, when people are fighting against each other, then some human beings may kill other human beings. With products that we have in our life, we might take the spray can and try and kill a cockroach or an ant, or mosquitoes, something like that. So we're taking the life of another living creature. But actually, taking the life of your own pet is very, very confronting. You have to live with that decision. And you're given a form to fill in. I'll show you that in a minute. You have to fill in a form and say, I agree. This is my pet and I want it to die. Just think about it. It's not something you're going to do many times in your life. Now, as a veterinary surgeon or a veterinary assistant, how can you help? So you're going to help by making sure everything is smooth, efficient, it looks professional. Remember, we talked about what's a professional, somebody that's got more training in an area than other people. So we want this to look like we know exactly what we're doing. We've also got to be able to explain what is going to happen. Explain it clearly so people have no hesitation in knowing that their pet is about to die. Veterinary assistants help by providing grieving owners with privacy, with tissues, information, even time. We allow people a long time with their pet, both before and after a euthanasia, and also trying to handle personal requests. Some people may want some music played. Some people may not even want to be there, but they want to have their pets harnesses or leads back, or sometimes people want the harness or lead to go with the pet to the next place, which we'll come across in a minute. Timing is very important. In a veterinary hospital, we would never make the last appointment of the day a euthanasia, because what happens with a euthanasia, people still want to hold on just a few minutes longer. They just want to cuddle the pet a little more. So timing doesn't work well. So if we're going to perform a euthanasia, we would rather get people to come in earlier in the day, or certainly at least 1 or 2 hours before everybody wants to leave and go home. So what is the process of euthanasia? And you'll see here 2 hands and a pen, because it's very, very important that whoever decides on the euthanasia signs a consent form. And you may think this is a strange thing, but sometimes some people bring an animal to a veterinary hospital for euthanasia and it's not their pet. We've had terrible situations, not recently, but perhaps I'll give you an example. A young woman in a house goes into hospital to have a human baby. When she comes back with her human baby, there's no longer her beloved cat, because the mother-in-law in the house has taken the cat to the vet and had it killed. Okay, some of you may have heard of other stories like this. Sometimes students go off to university. When they come back, their dog's not there because the grandpa in the house doesn't like the dog. So once the son or daughter goes off to university, they kill the dog. So as veterinary surgeons, it's of prime importance that we have a consent form signed by somebody who is authorized to make the decision on euthanasia. With dogs, it's a bit simpler, because all dogs in Hong Kong and many other countries, by law, by rabies legislation, have a microchip in them when they get a rabies vaccination. So by law, we have a registered owner of a dog. Unfortunately, other animals are not so lucky. So cats and small furry animals would not normally have a registered owner. But hopefully you can ask questions and try and decide if the person who's bringing in the animal is the owner that can give consent. Now this is simple, it's easy if you've been the doctor looking after the pet for some time, even since the pet was a pup, you know, a young animal. It's not easy if somebody just walks in the door of your clinic and demands euthanasia. And that's where, as a veterinary surgeon, I would have to perform a consultation, ask many questions to make absolutely sure this is the right thing to happen. Okay, because after all, I'm the last step, or a veterinary surgeon is the last step before an animal dies. And you can't give a life back. So when people are trying to decide, this can take a long time. It might take somebody a year to decide on a euthanasia, or it might take somebody simply a few minutes, depending on the situation. Number 2 on my list here, the decision whether an owner will stay for the euthanasia or not, is a very personal decision. People ask you all the time, what would you do if this is your pet? What would you do, Dr. Pauline? My decision on this is to ask an owner to stay with their pet. That's who's looked after the pet for its entire life, or ever since they met each other. And even though the owner of the pet may be emotional, maybe cry, maybe upset, going into a vet clinic normally for a pet can be a little bit emotional. They're used to being put on tables, they're used to having injections. And if their owner's there, I think without doubt they're a bit more calm and a bit more accepting. Okay, but of course everybody has a different decision on this, and it's a very personal choice. We always ask pet parents ahead of the time what they would like to do with the remains of the pet once the pet is dead, because then we have a body